When you think of the pelvis, which bone is the most important? Well, since they all work together, they're all pretty important. But in this episode, I'm going to dive deep into the importance of the sacrum, often referred to as the sacred bone in pelvic health. And I'm going to share with you why I feel this is the cornerstone of pelvic health and how mastering its assessment can transform your practice. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to this episode. I am excited to have you here because I want to share with you one of the most important bones, I feel, of the body, and that is the sacrum. And I'm sure I've talked about this in another podcast. I went and searched them all, but I didn't see the title sacrum on them. But I know I've talked to about it in the past, and I think it's worth hammering it home, the importance of this bone. If we look at the structure of the pelvis, the sacrum is wedged between the two ilia bone, and it is the cornerstone of the pelvis. And in my way of thinking of working with the body, I really want this sacrum to be nice and midline and happy and able to function well within the two ilia. And it is always the first bone that I assess and treat when I'm dealing with the pelvis. And I would encourage all of you to really learn how to assess and treat the sacral bone. It is so important. Sacrum actually comes from, I think it's the Latin word sacrum or sacred. And so it's the sacred bone in the body. And for our postpartum clients, if or at really any client actually, if you're really wanting to ground someone, if someone feels a little spacey, slide your hand into the sacrum and just hold their sacrum. That will help ground them down into their body more. And it's one of the first things that I do when I'm working with the pelvis is in supine, I will slide my hand underneath the sacrum. And I've shared this a lot in my live courses and maybe even all my courses. I love treating in supine because the weight of the bone is in my hand and it can I can feel so much more when the weight of the body is in my hand. And I feel like I'm in prone, I'm imparting into the body. In supine, I'm receiving information from the pelvic bones when I have my hand underneath there. And so I would encourage all of you listening into this, if you are a body worker and you're working with clients, slide your hand underneath their pelvis and allow that sacrum to rest in your hand. Now, what makes this more comfortable is I have a 3-inch foam pad that I use on my massage table, and that way I can easily compress down into the foam pad to get my hand underneath their sacrum. If you are missing that, if you're not using a foam pad on your table, please place a pillow between your hand and the table so that your hand is on top of the pillow and then your client is resting on your hand. That way your hand is not getting smushed between the pelvis and the table, and then your hand can relax and receive more information with the relaxed hand. If you're in pain, that and you're struggling because your hand is feeling compressed, you're not going to be as relaxed to be able to be receptive to get what you really need from this bone. The first thing that I like to appreciate about the sacrum when I have my hand underneath the supine patient is what is the shape of that sacrum. If I can feel the lower third of the sacrum and where the tailbone lands in my hand, then that's a pretty straight sacrum. If I can't feel where the tailbone lands in my hand, and this is important, I'll talk about it in just a minute. If I can't feel where the tailbone is landing in my hand, or I can't feel the lower part of the sacrum at all, that means that they have a more curved sacrum. So instead of being straight down, their sacrum and tailbone are curving forward in towards the pubic bone area. And so in order to be able to palpate the lower third of the sacrum and find out where that tailbone is, you have to extend your wrist and push your thenar, hyperthenar eminence of your palm up into the sacrum and feel where that bone is and where it lands in your palm. So I'm always looking to see, does that tailbone land in the midline of my hand? If it does, then I know that the sacrum is midline. But if it's going off into one side or the other side of my palm, then I know that there's a shearing of that sacrum. Now, I call it a shear. Some people might call it a side bending. We are all pretty much saying the same thing, but we just call it different things. And so that the position of the tailbone tells me if the sacrum is straight or if it is in an extend or if it's in a sheared position where it's kind of side bent off to one side. And usually in postpartum, I find a lot of tailbones side bent off to the right hand side. The other thing that I'm appreciating when I have my hand underneath the sacrum is what is there any hardness that I notice with that palm landing, with the sacrum landing in my palm? And usually, if this is postpartum, or if they've had a fall on their sacrum, there may be tension in that bone. And hardened bone is a traumatized bone. And if it's across the lower, like S3, 4 area, and there's a curve or the sacrum is curving up, it may be that that baby's head was just hammering that lower sacrum, trying to get on out. But if a person was on their back and that sacrum couldn't move out of the way, that baby had to force the rest of the pelvis to lift upwards for it to come on out. And then we can have this, it's almost a side to side kind of tension in that lower third of the sacrum. Just think about the baby's head coming through and that baby's head just putting pressure right on that lower sacrum. And that's why a more straight sacrum might make it easier for baby to come on out. The more curved the sacrum is, the more that sacrum has to lift backwards for baby to be able to pass through the pelvis. So we'll want to use that information with our clients if you find you really have to press up and in to find that end of the sacrum to get a sense of how straight or curved that sacrum is. Another thing that I will do with just my hand on that tailbone is I get a sense of the energy, especially if there's been a fall or your client reports that they have fallen in their past. And it could be at any point in their lifetime because that tension can live in that sacral bone. And sometimes the sacrum, when someone has fallen on the sacrum, sometimes that sacrum loves to have some compression up towards the head. And depending on what side they fell on, you may feel more of a compression feeling or energy on one side of the sacrum more than the other side, or sometimes it's straight in the middle. But if you can tune into that bone and ask it what it wants to do, and if you feel your hand getting pulled up towards getting pressed up into the spine, then that's usually a compression energy from a fall. And I like to just follow that if I find that. And then when I get to the end, it's like it's not going up anymore and I'm following it. It usually pauses and then it'll just melt and release and come back down. And so that's how I will treat a fall or compression. Now, if a person has, I just had a client today who had some disc issues at L4 at the lumbosacral junction. And I needed to put my other hand, my fingers at L5. and offer a decompression of the lumbosacral junction in there. So getting S1 off of L5. And that can be really helpful to create space in there, especially after birth or especially after a fall. So that compression up from falling is another assessment that I do when it is when I'm aware of it. Sometimes the client doesn't remember because maybe it happened in childhood or when they were a teenager. I was working with a 14-year-old. I think I did a case study on this podcast a couple of months ago, maybe, or weeks ago. And the 14-year-old had bladder issues. And when I went to put my hand underneath here, her lower sacrum was just hard and it had compression energy up towards her head. Her tailbone was not happy. And when I say not happy, I mean that the tissues are hard. There's tone in there. It's not just this soft like kind of tissue. And when it's that's happy to me. When it's not that, there's tension, tone, and it's just you can sense it in the tissues when you expand your palpation skills beyond what is the structure and is it tight or not. There's a whole nother range of assessment that you can do by tuning into the tissues, and I like to call them happy or not happy, unhappy tissues. And so the 14-year-old, by clearing away that compression of the sacrum, getting the tailbone happy, the tailbone and the bladder are very intimately connected. So if you have bladder issues, make sure you are checking out the tailbones and making sure they're happy and they have good spring and mobility and there's no compressive forces in it, and especially if it's in a good position. And so helping her release that 14-year-old, her bladder felt much better after that session. Okay, so tailbone, is it in the middle? Is there compression? The other thing I like to do is actually come up and do a PA, so posterior to anterior mobilization at S1, S2, S3, and S4. And if I feel tension in one side of the sacrum, yeah, it's hard. The sacrum feels harder, usually around that S2 to 4 level. I am thinking uterosacral ligament. Okay, so I want to assess that uterosacral ligament and see, because that could be where it is attaching into if that sacrum is hard on that one side. And I have to say that so, and remember, in pregnancy, and I'm thinking about the patient that I just worked with today. In labor, that sacrum has to lift backwards for the baby to come on out. If you put your hand underneath that sacrum and it's really pressing into your palm because it's more in a flexed position, that may be an indicator that it is in a stuck, flexed position. So if you feel excessive pressure at S3 and 4 and tailbone into your palm, please consider that the sacrum is in a flexed position and learn how to treat it. There's a free sacral flexion course on my website. Please make sure you check that out and learn how to treat that. So I teach you how to do that in that course. All the other techniques you can find in my other courses. So once I am just assessing the sacrum and what I can tell from without any movement, then I like to go into the movement of it, and I want to do sacral rotation. I want to do sacral extension through flexion. I want to do the ILA mobility. And then I want to check out the shear of the sacrum side to side. So for those of you that have taken my postpartum course, you know how to do the shear, you know how to do all those mobilizations. Hopefully, if you don't, this is your reminder. Please go back and look at that and get this in your hands because it is so important. Now, my approach to the body is that I do everything in supine. Now, if I had someone who is really obese, then I would not do all the spring testing in supine. I would turn them over and then do the spring testing of the sacrum in prone. If um, if I am treating someone who's not obese and I am trying to mobilize the sacrum and I get one side better, but maybe not the other side moving as freely as, I'm always comparing left to right side. If left side moves really nice and easily, then right side should as well. And if I don't feel like I can get that evenness of mobility side to side, then I will turn my patients prone. And then I will do the sacral rotation. I'll do the inferior glide, the shear, all that you learn in the holistic postpartum and treating the postpartum pelvis too, course, those courses to um, try to get the two sides to be the same. And these are just the techniques that I'm teaching in the courses. Sometimes when I'm in the clinic, I'm just pressing around and seeing what needs to happen. Sometimes there's something in between all those techniques that pops up that is like, oh, that really helped. Now, I was working with a man who had he was riding a bike when like L5 just went posterior on him. I think he was over efforting or something. But L5 was so hard. The spinous process of L5 was so hard in his back, and it was really prominent, and it had lost its forward mobility. So instead of listhesing forward, it was listhesing backwards. I can't remember if he told me if he had X-rays or not. And it may not have looked different or bad in an X-ray, but I could tell from palpation L5 was not happy in there. And so I just worked on trying to mobilize him, and then I got him in prone, and see that's where like in supine, as I was pressing up on L5, I could really feel a difference in that bone compared to 3, 4, and 1 of the lumbar spine. And so that's why that bone just popped into my hand because it was so prominent and so hard. Today I was working with a gal and C3 was really prominent. She was in supine and I was pressing around, feeling her suboccipital area. And I got down to C3 and I was like, wow, have you injured your head? Have you hit your head or what have you done? Because C3 wasn't happy. But that's how I'm assessing the body now, is just seeing what bones what part of the body is speaking loudest to my hands and what part of the body can't move and what needs to happen to make it move. Well, this biker who had this L5 hardness, his sacrum was not moving well. And I just kept doing different mobilizations. And, he doesn't have a uterus, so I wasn't checking anteriorly. I did do a lower abdominal fascia sweep on him, but it didn't feel like it was anterior. It just felt like something was weird in this low back sacral, lumbar sacral area. And eventually, after just kind of playing with different angles and different pressures on that area, it just let go. And then I had even mobility side to side, like the left side felt like the right side in the mobility. And so that is my goal when I'm working with the sacrum, is to get that even mobility of that sacrum in that sacroiliac joint to be the same, to be mobile, to be even side to side. So that is, then once I get the sacrum happy and moving in there, then I want to balance the ilium and ischiums around that. And so, again, I teach that technique in the pregnancy, postpartum, and postpartum pelvis course. So you can check those out there. But this is just my theory, my philosophy, my approach to the body. And I really do feel that the sacrum is a huge, huge um, it's the cornerstone of the pelvis. And so we need that cornerstone to be level and even and able to move. And then we can balance the ischium and ilium around it. So that is my approach to the pelvis. And I truly hope that each and every one of you will start putting your hands underneath the sacrums in supine with your patient in supine. Put a pillow between your hand and the table so that your hand can relax. Get a foam pad if you're going to do more of these techniques. It's definitely a game changer. I recommend a 3-inch foam pad on your table. You can get them at Amazon for $30, $40. And it just please assess the sacrum, assess and treat the sacrum and make it happy again. Okay. Thanks everybody for listening in, and we will see you all in the next episode. Here is to smoother births, faster recoveries, and please share this episode with your colleagues so that they too know how to better assess the sacrum. Thanks so much. Take care. Bye-bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.